Chairwoman Friedman, Chairman Lon, and members of the Joint Committee on Healthcare and Financing. My name is Barbara Galanek, and I'm from Wilbraham, Mass. I am a retired teacher of 25 years for the town of East Long Meadow. I'm pleased to offer testimony in support of an act establishing Medicare for all in Massachusetts. My story is pretty unremarkable. It's really even common among the retired, yet I count myself fortunate because I actually have what would be considered good health care coverage, which is a luxury for many senior citizens and retirees. In 2001, I was diagnosed with multiple sclerosis, which is a chronic debilitating disease of the central nervous system with no cure, but extremely expensive treatments. According to the manufacturer's website, the list price for the drug I use to control the progression of this disease is $93,295.70 per year. I quote them, "The amount you pay for the drug will largely depend on whether you have insurance, the type of insurance you have, whether your insurance provider considers the medication to be preferred or not preferred, and whether you have met your deductible." This past year, I experienced a reaction to the medication I had previously been taking and had to stop it. I quickly began to show increased symptoms of my MS, but was forced to wait an additional month and a half before my insurance company decided they would grant me permission to take a new medication, as well as how much I would be required to pay for it. I ask you, why are insurance company bureaucrats deciding whether or not I should take a drug lawfully prescribed by a medical doctor, a licensed and certified professional in her field with years of training and experience? I pay monthly bills for medical coverage, employers' health and dental insurance, co-pays, deductible, and prescription drug costs. Last year alone, I paid $10,285.10 for medical care, which does not include my husband's coverage or the additional cost to the town of East Long Meadow for my coverage. This is a price that senior citizens, retirees, and towns or cities of the Commonwealth can ill afford. In fact, the cost of insurance coverage, as well as the probable need for long-term care in our futures, prompted my husband and me to sign our home of 40 years over to our daughter in order to preserve something, anything, from the coffers of the insurance and pharmaceutical giants. So now I ask you, how much is enough? How many people of this Commonwealth need to be reduced to poverty levels before the voracious greed of these insurance and pharmaceutical companies is satisfied? I appreciate your time and consideration on this important legislation, and I too ask for your support of H1267 and S766, an act establishing Medicare for all in Massachusetts.